I think it's important that I communicate to you folks that we actually live here. I'm not in Chicago or Charleston, South Carolina, or anything like that. Just trying to connect to certain regions. We live here. My wife is actually on the call with us today. Kelly, you can see her there. And we have a small ranchette in Bergheim, Texas, which is just south of 46 on Ralph Fair Road. I spent about a quarter century in the military, split between the Army and the Air Force, most of it in the Air Force, and nearly all that time was spent inside the military health system. Within that construct, I was in primary care, so family medicine, pediatrics, women's health, and so forth. And then after the military, after I finished my last assignment as a commander at Spangdahlem Air Base in Germany, I came back to the United States and I went to work for United Healthcare on the medical operations side. And I was doing clinic operations in the Dallas-Fort Worth area. So, and the unique thing about that was that we specialized in providing care to seniors. So it was almost exclusively Medicare Advantage. So I do have a unique qualification to feature some of these. My apologies, my phone's ringing. I do have a unique qualification to talk about the way that these plans translate into actual care that you get in the clinical environment. So just a couple pictures of us, one when we were both on active duty, one in front of our church in a Christmas picture, and then one right before I took command of squadron command. So my objective while we're chatting today is really, it's even more focused than this, is to explain and select and help you select the best plan that fits your needs based on your special status as a veteran and someone who receives care through either the VA or the DoD and accesses Medicare Advantage benefits or Medicare benefits, or wants to do that or wants to know more about that. So I'll be completely agnostic of the plans as we're going through this because this is strictly an educational event. I'm going to help you understand the elements of Medicare and the purpose of each of those, and then the cost and some of the gaps that exist and how we can overcome those gaps with specific products. So just a couple more pictures of us. Those are our goats in the left-hand corner. Those are our first real livestock on the ranch. Their names are Brooks and Dunn. Picture me playing golf, which is my favorite hobby, holding one of the goats, and then with our dog Patton. So that's our life on the ranch. That's how we live. And Medicare is what I do for a living. So Medicare is a federal health insurance program for eligible citizens, okay? And we'll go into what that is on the next slide. Thing to take away here, it's not free, all right? Medicare is not free, and if you're already enrolled, you understand that. U.S. citizens and legal residents who have resided in the U.S. for 5 years, including those immediately preceding the application for Medicare, are eligible. You just need to be 65 or older or have a qualifying disability, and those are varied, and I can talk to you if you have questions about that. So that's really it. And the big thing is when you were working in the workforce during your life, you probably remember intimately the line item on your pay stub that said Medicare, Social Security, and FICA. Well, those withholdings from your check actually paid for the first portion of Medicare, which is Part A. So you actually paid for your ability to stay in the hospital under Medicare coverage during your time in the workforce, all right? So that is covered. And basically what it means is that you can't be denied coverage. And as long as any hospital accepts Medicare, you can actually be admitted to that hospital and you will be covered for a specific benefit period, which are generally 60 days at a time. And most of your costs will be covered, relatively speaking, but you'll still be subject to perhaps some premiums, most likely a deductible, and then costs for each day in the hospital past a certain number of days. Part B. Part B is not paid for. Part B requires that you pay a premium. I'm going to say that about 100 times in this brief because it's very important to understand that no matter what product you enroll in it, whether it be a Medicare Advantage program, a supplement, you purchase a prescription drug plan, none of those negate the requirement to pay your Medicare Part B premium, which you can do by accessing ssa.gov and signing up for Part B and making sure that you're paying that every month. One of the things I say to folks when I'm enrolling them in a plan or they're asking questions about a plan is Part B is like breathing, okay? You do it until you're no longer around. It has to be done. So it's a fact of life, death, taxes, and Part B has to be paid. And the reason that it's so important to mention that is you can actually be subject to some penalties, which I'll talk about coming up. The cost of Medicare are broken down into 4 basic cost groups, one being the premium, which is like a subscription that you pay each month. Again, Part B, not likely Part A, but definitely Part B. Deductible is a set amount that you pay for covered services before your carrier or plan begins to pay. When I say carrier or plan, I'm talking about companies like Aetna, United, Blue Cross Blue Shield, Humana, and so forth. A copay is an agreed upon amount between you and the health provider that you pay at the time you receive service, i.e. that $15 or $20 that you give to the doctor at the doctor's office. And then the coinsurance, which is really what original Medicare is based on, is the amount that Medicare pays or the carrier pays and the amount that you as an individual pay. If you're on basic Medicare, essentially for all services in the primary care environment, you're going to pay 20% of those services, and Medicare is going to pick up the balance of 80%, which is pretty good, but depending on the amount that you're charged during your encounter, it could still be a substantial amount of money. A quick run through of a stay in the hospital. You're going to have to pay a premium, a deductible, possibly other costs with no out-of-pocket limit. And the next slide actually gives a great depiction of that. This is a 65-day stay for a guy named Matthew. He was admitted 2 times. The first time for 5 days, then he was out of the hospital for a while, and then he went back in for an additional 65 days, and 60 days passed between the time he was discharged from the first day and he was admitted for the second. Because of that, he's going to pay 2 deductibles because those are 2 separate benefit periods. So before he receives any care at all in that hospital setting, for each of those stays, he's going to pay $1,340, all right? Then he eclipses the 60-day mark, which are covered under basic Medicare. And between days 61 and 90, each day in the hospital is going to cost a beneficiary on original Medicare about $335 per day. So his total bill for a I just got myself mixed up there. A 70-day hospital stay is about $4,355. So that's on original Medicare. And we're going to talk about how to drive some of those costs down. The stages and the elements of cost under Part B are that monthly premium. Remember that monthly premium, it always gets paid. Then there's also that deductible we talked about, the amount you pay before the carrier picks up any of the cost. And then the 20% I mentioned being your cost share. And again, no out-of-pocket limit on original Medicare. So there are some options to hedge against some of those costs and guarantee that you're not going to be subject to a cost structure that doesn't have a maximum out-of-pocket limit. And these are basically offered in 3 different products. One is a Medicare supplement, which is specifically a plan that helps pay for those out-of-pocket costs that we just talked about. It pays, in some respects, it pays for deductibles. It pays for extra days in the hospitals. It may pay for a portion of your Part B deductible if you qualify for that. Another element that you can add and actually you must add because it's not covered under original Medicare, is Part D, which actually is a big component of your healthcare plan and helps pay for your prescription drugs. Now, I want to talk about this specifically when it comes to veterans, and I'm going to talk about that a little bit later and get into details about it. But if you're a veteran who receives benefits via TRICARE for Life or the VA, and you are able to actually go to either a military treatment facility or a VA medical center or outpatient clinic and pick up your prescription drugs and pay nothing for those based on your qualification as a beneficiary or a disability rating, you do not, I say again, do not purchase a Medicare Part D plan. You're simply wasting money. You already have a benefit that is a very good benefit, and you should retain and use that benefit. Additionally, if you were to choose the third product available that helps you pay for Medicare, which is a Medicare Advantage plan, you would not want to purchase a Medicare Advantage plan that offers a prescription drug benefit. There's a couple reasons for that. The first one is you don't need it. You already have a drug benefit. The second thing is if you do sign up for a prescription drug plan, the carrier will actually require that they bill the DoD for the benefit that you've consumed, and that becomes an administrative nightmare, and it's something in the industry that we're warned very widely not to enter into. So be very confident in the fact that if you actually do get your drugs from the VA or the DoD, you have an excellent, a very high-end prescription drug plan, and you do not need to sign up for another one. Additionally, that ID card that you carry in your pocket, and I'm going to go into this in just a little bit, acts as a Medicare supplement plan, and it picks up the remainder of the costs that are not covered by either a supplement or a Medicare Advantage plan. So if you signed up for a Medicare Advantage plan, regardless of carrier, and you went to a clinic and say Spring Branch, a specialty provider over there, and they said, okay, sir, your copay today, or okay, ma'am, your copay today is $35. You simply present your DoD ID to them, and that clinic bills, or actually the carrier bills the DoD and the military health system, and they pick up the cost. So, and we're going to go into a cost share matrix that talks about that. That's what I was talking about when I said these plans work wonderfully together. And the reason is because you can take advantage of the of many of the attributes of a Medicare Advantage plan, while at the same time using your DoD plan to cover the extra cost as a second payer. I saw, did we have a question come up, Cal? I think that's,
yes, we did.
okay, I can answer it now.
Can they fill prescriptions prescribed by a doctor outside of the VA?
Can who fill prescriptions?
The VA. Thank you.
If you have a VA drug benefit, that's a very good question. It would depend on your disability rating. And let me think about that. That would be, I believe the right answer is, but I'm actually going to confirm it is if you're assigned to a PCM via the VA. So let's say you're in the Chavano Park VA clinic, and that provider writes a prescription for you, then I do believe the answer is yes, and you can have it filled at a pharmacy. You also have the option of going to one of the VA clinics to have it filled there. But if you're just episodic and you're not assigned a PCM and you're going to the VA for a service-related disability, and it's just for, let's say, knee pain that you had and your disability rating is 10 or 20%, you are probably not qualified for a full prescription drug benefit through the VA. I believe the disability rating of 80% authorizes you to enroll with a primary care provider in the VA and access a full pharmaceutical benefit. But I need to get a little bit more information on that to make sure that I'm answering you correctly.
So yeah, we'll get back to you. We can send the answer to Bethany and she can send it out to you all.
Pardon me, drinking coffee.
You all right?
I'm fine. I shouldn't have taken a sip of coffee. Okay, so Medicare Advantage is a program developed by specific plan carriers that filled the caps of original Medicare, right? So these are agreements between the carriers and the federal government to administer the Medicare benefit to beneficiaries. And so what they do is they compete with one another to essentially recruit beneficiaries to enroll in their plans, and then they provide care within the constraints of those plans to the lowest cost possible while still adding features to the plans. You'll see in the center it says prescription drugs, but we talked about that, and specifically with veterans that have that pharmacy benefit, then you would not want to purchase that portion. You could actually find a Medicare Advantage plan without prescription drugs, MA only. What it does offer, though, is an opportunity for you to access dental, vision, and hearing benefits, as well as wellness programs to local gyms and transportation benefits as well. To and from the doctors, as many as 24 rides, two-way trips per year to the doctor. So those are benefits that were just until recently really not available. And if you're on a TRICARE for life benefit right now and you're on original Medicare, you don't have access to any of those. So this is the biggest thing. Folks are saying, well, you know, I really would love to have a Medicare Advantage plan, but I don't want to lose my TRICARE for life. And I said, oh, well, it's not the case. You could actually enroll in a Medicare Advantage plan and get your dental, vision, and hearing coverage, as well as a free gym membership, and you don't pay $1 for it, especially in the San Antonio area. There's so many carriers offering premium free plans. So there's really, on the part of a beneficiary, there's no risk, and it's kind of a reward for your years in service. So just a couple fast facts about that. An Advantage plan is a network-based plan, okay? And it does have an annual limit of out-of-pocket costs for covered services, and sometimes has a monthly plan premium. But once again, the plan premiums are often $0, and the out-of-pocket costs do not apply to you because you're a veteran and you have that DoD ID card. So you can present that at the time of your visit, and that is actually covered by the DoD. So it's a huge advantage for veterans that have an existing benefit. We're not going to talk about the prescription drug benefit in great detail, but in the interest of maintaining compliance with this particular brief, I will say that Part D plans offer additional prescription drug plans that complement the original Medicare plan, and they can be purchased from carriers and are at a reasonable cost and really do drive down the risk associated with the cost of drugs and so forth. And all of these plans are offered by private insurance companies. And Kel, if we have more questions, you can just say, hey, I have a question, and cut in, and I can answer those, or we can wait to the end. It's completely up to the person asking the questions.
Okay.
So the drugs that are covered under Medicare and Part D plans are broken down into 5 categories that they call tiers. This is essentially very similar to, you know, looking at a restaurant review or a list of restaurants on Yelp that have the dollar signs attributed to them that shows you how much they cost. Certain drugs cost more than others, and others are much cheaper. And so they use the dollar sign in the tier system to identify the cost of those. There's 4 stages to the prescription drug coverage life cycle, and those are the annual deductible stage, the initial coverage stage, the coverage gap stage, and then the catastrophic coverage stage. Really, a very small percentage of people ever exceed the initial coverage stage and end up having to go into the coverage gap, where they can actually be subject to up to 20% of the cost of drugs. If you do get to that point, even have an aggregate total of $5,000 per year of out-of-pocket prescription drug costs, you will then eclipse the coverage gap stage into the catastrophic stage, and you'll pay a very, very low amount for your drugs. I can talk specifically to folks that have those concerns. It's probably a better venue to do it, to break it down, look at your medication list, and answer your questions about each of the individual drugs and the costs you anticipate. And every year this cycle starts over, so it doesn't aggregate and then roll over from one year to the other. It's based on the amount of money you spend on drugs each year, which starts on 1 January. So just kind of a wrap up on that is, if you don't have a benefit that we've talked about related to your service in the military, you do have to be enrolled in a Part B, or you could be subject to a penalty for that. And the coverage on each of those plans costs varies by the type of plan. Some of them have a much lower premium and a higher cost copay for the individual drugs, and then vis-a-vis, they may have a higher premium than a lower cost of individual drugs. Medicare supplements are essentially those plans that pay for a portion of the cost that you pay that Medicare doesn't cover, or the gaps. You might have heard of these called a Medigap plan. And they're basically coded as Plan A through Plan N. Some of them pay for additional days in the hospital. Some of them will pay your all or part of your Part A deductible. Some of them will pay, if you qualify, your Part B deductible, time in long-term care, skilled nursing facilities, and so forth. So essentially, where original Medicare stopped short, and you kind of have to face that no out-of-pocket limit, these Medicare supplement insurance plans give you that assurance that they're going to pay for those costs if you do incur them. The good thing about supplements is the assurity that they're going to pay for them. Also, they're very portable. You can use them anywhere in the country as long as the provider accepts Medicare. One thing to remember with supplement insurance plans, Medigap plans, is they do cost money. So unlike a lot of the Medicare Advantage plans, which are premium free, supplements actually cost somewhere in the area of about $125 to $150 a month, depending on which plan you purchase. So you're going to end up paying. Go ahead, please.
Hey, Tom, there is a question.
Uh-huh.
With an Advantage plan, will my dad, the beneficiary, have to fill out paperwork for TRICARE to pay? We heard there was a form for reimbursement.
You should not have to. I have heard that there are some stories of people doing that. I'll actually show you the verbiage directly with, as a matter of fact, let me back out right now. I'm going to go ahead and new share. I'm going to go into here. Okay, so this is the actual way that you pay for your health benefits when you're a dual eligible Medicare Advantage recipient, as well as you're a DoD beneficiary. And this is covered specifically under here where it says how it works. And this is what I use to brief. So your provider files your initial claim with Medicare. So let's say you go to a specialist in Spring Branch. All right. You show them your Medicare card, your Medicare Advantage card, and then so they're going to file their claim for the care they provided you against Medicare. Then Medicare pays its portion, sends the claim to TRICARE for the TRICARE for Life claims processor. So it should not be the beneficiary that does that. All right. TRICARE for Life then pays the provider directly for TRICARE covered services. You don't receive a TRICARE wallet card. All you need is your military ID. So unfortunately, I have heard about some offices and folks not having a good understanding of what the process is. I am more than happy to send a link to this specific page for Medicare beneficiaries so that Bethany can pass it on to you so that you can use that, how it works, 4 bullets to help you if you encounter that. You should not be picking up the administrative burden, filing a claim, filing a group of claims, or anything like that. If you do have a situation like that, it's more than likely someone is not aware of the requirement and might need to be reminded of that. I'd be happy to talk to you about that offline if you're having specific issues with that. I'd actually like to know about it so that I can educate myself a bit more as well. But that's how it works. That's how it's supposed to work right there. And it's unfortunate if that's not what you're experiencing. Any follow on, Kel?
Thank you. That helps so much.
Okay, good. I'm glad. All right, so the Medicare coverage combinations, you essentially have 4 combinations that can be broke down into what I say sub-combinations. You've got original Medicare, which is Part A and B. Then you've got A and B where you add a supplement plan. Remember, we're talking today specifically about and addressing questions about vets, so that's not really a requirement. And then you can add actually a supplement plan and a PDP, which gives you a very good coverage, On the Medicare Advantage side, you can purchase an Advantage plan with a PDP, or you can purchase just a Part C, which is Original Medicare Advantage. Actually, I should just say, which is Basic Medicare Advantage, or MA only, so that I don't confuse it with Original Medicare. So that's really, those are really in kind of a nutshell, the coverage options that are available in the Medicare environment. So this is just a kind of a recap on what we were just talking about. You got original, A and B. Your first option is to add a supplement or a Part D, and then your second option is to look into an Advantage plan that offers those attributes together as well. The enrollment period for Medicare, and this applies as well, if even if you're a TRICARE for Life beneficiary, it's generally 65 years old, or if you have a qualifying disability and you've been receiving Social Security benefits for 24 months, all right? You can enroll in a Medicare or prescription, you can enroll in a Medicare Advantage or prescription drug plan during that time, all right, which would mean just a Medicare Advantage plan. Let's see, how's my screen look, Cal?
I think we need to reshare to the presentation.
Oh my gosh, I'm so sorry. I apologize. Okay, so those were the Medicare combinations that we were talking about. The one I really wanted to highlight today was the options for DoD beneficiaries, which would be essentially on the Medicare Advantage side, number 6, which would be a Medicare Advantage only, or a Part C, because you already have access to that drug benefit, which is going to give you the extra attributes offered in a lot of modern Medicare Advantage products. So really, what I really want to do now is, Bethany, I'm actually going to, I'm going to back out and I'm going to pull up the information that I have on TRICARE for Life, because that's really what I want to share with folks, and pull up the cost matrix, which is a big thing. And I think it's right here. So can you guys see that?
Yes, that's what we're seeing.
Okay, so actually this is the 2020, the 2021 had not been published. I just looked for it a little while ago. It's highly unlikely that there's going to be any changes. You certainly would have heard about it by now, so I feel confident that what I'm briefing you today is going to hold true in 2021, maybe with the exception of just a few dollars in what TRICARE pays, but it's really not going to affect you. So remember when we started with the Part A, and we looked at that $1,400, I think it was $1,430 that you had to pay for your deductible. All right. So if you're a TRICARE for Life beneficiary, all right, you pay nothing for that. Okay. Your DoD ID card picks that up. Same with your days 61 through 90 and 91 through 150. So out of all those times, you pay zero, which a standard original Medicare beneficiary, if they had 150-day stay in the hospital, it essentially adds up to about $40,000. All right. Now think about that. That is a lot of money. As a DoD beneficiary enrolled in TRICARE for Life and a Medicare recipient, Medicare picks up that first portion, and then TRICARE picks up that second portion. So you can see that you have such an extraordinary benefit that it really pays. I mean, your time in the service has really paid a huge dividend for you, and the number of folks that stay in the hospital, for 150 days is extremely, extremely small. Let alone, even 2 weeks or 3 weeks in this, in kind of the modern environment and so forth. So you're really kind of looking at something here where you're not ever going to face having to pay for days in the hospital. All right, and I can scroll down here. There is some possible cost for stays over 150 days. I don't really think that that's relevant for this particular discussion, but it is good information to have. If you did fall into that category, I'll make sure that it's available. And then the good news just keeps on coming as you flow down through here. For mental health services, no deductible, TRICARE picks it up. No charges for days 61 through 90, TRICARE picks it up. And look at these per day costs. I mean, those are very significant. All right. Continuing on to Part A. And this is similar to the last one. This is 100 past the 151st day. So not likely, but there would be some cost incurred there at some point. Skilled nursing facility, nothing. TRICARE picks it up. Days 21 through 100, nothing. TRICARE picks it up. And so you can kind of see, and the theme just goes on and on and on. That skilled nursing facility over 101 days. Hospice care, actually hospice care is covered by original Medicare, and regardless of your status with the military, you'd never have to pay anything for your days in hospice. But look at this, look at these zeros going down here. This is just amazing. The first time I saw this table, I said, thank God I'm a TRICARE for Life beneficiary, because this could be pretty daunting. It really could be pretty daunting, but you pay nothing, with the only exception for chiropractic services, because it's not paid for by TRICARE. You'd actually regress back to your Medicare benefit, and they would pick up 80% of the cost, and you would be responsible for 20% as a cost share, but it's only for manual manipulation of the spine to relieve pain. So it's not for massage or TENS devices or pressure point or anything like that. So that's really, that's the nutshell, folks. This is like what I call the golden goose beneficiary matrix here. And it really provides an extraordinary view of what is covered under your TRICARE for Life benefit. So with that, I'm happy to answer any questions that you have about veterans accessing the Medicare benefit and considering Medicare Advantage as a part of their health plan.